Hi, I'm Dr. Mian from Neuro Wellness. Over here at Neuro Wellness, one of the main areas that we practice in is neurology. In the field of neurology, we see a wide variety of disorders. We see people who have migraines, we see people who have seizures, we see people who come in with memory issues, we see people who have various aches and pains, as well as numbness and tingling. So we see a wide range of people with a wide range of disorders. And we try to tailor treatments depending on what the patient has. And sometimes they may require additional holistic approaches in addition to some of the traditional treatments that we do. One of the more common treatments that we do for some of the chronic pain issues is PRP and prolotherapy, which are regenerative treatments to try to help heal the areas of damage, to try to help restore integrity of the various structures within the spine, the knee, the shoulder, or the hip, so that people can alleviate some of the pain that they're having. For migraines and headaches, we see this quite commonly, and for some people it may mean that we have to change their diet, or we may have to look into things a little bit more in depth in terms of their blood work or additional diagnostic testing to see if there's anything else that may be accounting for their headaches too as well. When it comes to areas of memory loss, it's also a very common issue. We see it not only in older folks, but also in younger folks. So more often than not, we have to look at things in a lot more detail too as well. In some cases, we may find very small issues, such as vitamin deficiencies, which may spark some memory issues versus someone having poor sleep too as well. We do also look at patients who have Alzheimer's and other types of dementias too. When it comes to things such as dizziness or lightheadedness, it's also a very common condition that we see. We see people who have had this issue for a long period of time, and we see some people where this disorder comes on very quickly. More often than not, these conditions can resolve on their own, but sometimes when they're more persistent, that's when we go ahead and look into things a little bit more in depth, and we may look into some imaging of the brain, we may look into some diagnostic testing that we do here in the office. And in a lot of cases, we'll be able to arrive at a point where we can figure out what the issue is, and then we can kind of strive to make sure that we have the right kind of treatment, whether it's therapy, medication, supplementation, in order to try to help alleviate that condition.